Hi, my name is Constance from Trust Hospital, Surgical Unit to be precise. So we are coming to talk about a little of the do's before surgery. So the very first thing you have to know is you need to understand your condition. You have to know your diagnosis. You need to know the procedure you are coming for so that you can sign a consent form, because that is the next thing you will do. Sign a consent form when you get to the ward. Following, you need to report to the ward the day before the procedure. If it's a major procedure, we have day cases. We have cases where you have to come to the ward for proper monitoring. If there are some labs to be done, it will be done. If there are some monitoring to be done, especially if you have some conditions. So you need to report before the day of the procedure. The next thing is, when you come to the ward, you have to let the doctors and the nurses know your previous medical reports, including if you had any form of surgical interventions, which involves putting, in simple layman's, with a metal inside your body. If you have an artificial pacemaker, you have to let us know. If you have diabetes, you have to let us know. If you have asthma, you have to let us know. If you have GCSD, either full defect, partial defect, you have to let us know, because it will all help with the safe period care, which will intergo with the intra-op and then post-op care too. Another thing you have to know is you need to let the nurses and the doctors know your allergies. You might be allergic to certain medications that you know. So the known ones, you have to let us know. You could be allergic to paracetamol. Yes, everybody and their condition. Some will say common paracetamol. It's not common to everyone. You might be allergic to it. Voice it out. You might be allergic to ciprofloxacin, any medication, morphine. There are some conditions when you go to the theater. As part of the anesthesia medications, they add morphine. So you have to let us know if you are allergic to it. Maybe we didn't indicate. We have something we call pre-op checklist. We will add it. We will indicate your allergies too, so that it will alert the surgeons when you go for theater. You also have to let us know if you brought any medications along with you. And with the medications, you have to comply with what the doctor or the surgeon told you, especially if you are taking anticoagulants. So with those medications, you have to stop them at the appointed time that the surgeon asks you to stop. There are indications for every type of medications, and we do tests too to know your blood levels in layman's language. So you have to follow the exact time. Sometimes you stop for some number of days. Other times you just stop a day before the procedure. You have to know. Then you will have to follow the fasting protocol. We call it fasting protocol because you have to follow about 6 to 8 hours fasting. You wouldn't eat within those hours. Even with that, if you are hypertensive, through the monitoring processes, you will have to take your antihypertensive in the morning of the procedure with little amount of water under supervisions. Some people too may not be hypertensive, but because of their condition, they might be prescribed with some medications we call benzodiazepams. Those medications, sometimes you take a tablet in the morning or a dose in the morning before procedure. That one, you take it with little amount of water under supervision. I keep repeating under supervision because we need to monitor. You might end up drinking more than you have to, which will compromise the surgery, the procedure.